In this morning's Flu Watch, we have new numbers showing the extent of the H1N1 epidemic. We first reported Monday that the number of victims was much higher than the official numbers that were reported by the Centers for Disease Control initially. The CDC is now saying that 22 million Americans have been infected with H1N1, nearly 100,000 have been hospitalized, and almost 4,000 have died, including 540 children. Dr. Ann Schuchat is the CDC's Chief Health Officer for H1N1, and she joins us this morning. Dr. Schuchat, good morning.
Good morning.
We have almost quadrupled the number of deaths from H1N1 than initially reported, and you've said that you expect these numbers to continue to rise. Is the CDC changing its recommendations with regards to treatment or prevention in light of the new numbers?
The new numbers just emphasize how important our recommendations are. We've known that this pandemic was disproportionately affecting children, and so many of our vaccine recommendations do target the young. We also really think antiviral medicines are critical for people with warning signs, severe presentations, and adults and others with chronic conditions like asthma, diabetes, or people who are pregnant. So the new numbers really just emphasize how important those recommendations are.
So the recommendation is still get the vaccine, but there's a major shortage. We have 41 million doses available, which is a couple of million less than the CDC predicted just last week. So what do you say to people who are most at risk, who are trying to obtain this vaccine, prevent this virus, but they just can't?
I wish it were easier for you to find the vaccine in your communities. Things are getting better each day, but it's not quickly enough. And I know how frustrating it is for parents who aren't able yet to find the vaccine for their kids and for others waiting in line. The states and cities are really doing a terrific job of trying to get vaccine in places where priority populations can find it. And I hope that it'll get better in the days ahead. But really, I ask for people's patience. It's very important to be vaccinated, and we just wish it were easier for you.
We have no way of knowing where we are, right, in this pandemic, whether this is the beginning, the middle, or the end?
That is one of the hardest questions about influenza. It is unpredictable. We know that in pandemics in the past, there have been multiple waves. So even if things do start to get a bit better over the days and weeks ahead in terms of the counts of illness or the patterns of illness, flu season can last until May, and we really think we have to be on alert and taking steps to protect the population through the next several months. So exactly what course the virus will take, we just don't know.
And there's just no way to know then if you're going to have enough vaccine to prevent this as we'd like to.
We think it's critical to use every dose that's produced, and the states and providers are really working hard with that. As the vaccines come out, of course, it's slower than we had hoped for to get every dose used as quickly as possible. We do expect more and more product to become available over the weeks ahead, but we do think vaccination is going to go on for several months.
Dr. Ann Schuchat, thank you for taking the time this morning.
My pleasure.